Imagine losing your wife while 9 months pregnant because the nearest hospital is 45 miles away, and the people in power aren't even in Washington to stop it. Congressman Bennie Thompson calls out House Republicans during a government shutdown, saying it's absolutely maddening that they're absent while millions of Americans face skyrocketing healthcare costs, hospital closures, and life-or-death emergencies. This is real families paying the price for political games, and Thompson isn't holding back.
Thank you. Thank you, colleagues, for the opportunity to speak this afternoon. I accept everything that's been said by you. For the record, I'm Bennie Thompson. I live in a community of 500 people. I've lived there my whole life. We don't have a doctor, but we have a veterinarian. There are a lot of other things that rural America provides that some people take for granted. But healthcare is precious. My district is 300 miles long, 200 miles wide, and it covers 40% of the whole state from a geographical standpoint. I've represented it for 32 years, and I've been honored to serve the people who call this area home. It's important to understand that because of this so-called big ugly bill, the Republicans plot to gut the ACA tax credits for over 15 million Americans who stand to lose their coverage. It's absolutely maddening to see House Republicans on the retreat today and not being here in Washington to work for the American people. If the Republicans' ACA tax credit expire, 81,000 people that I represent will lose their health care coverage. This impact is real. A 44-year-old small business owner in my district pays about $269 per month for coverage. If those tax credits expire, that will cost $891 a month, a 331% increase in premium. House Republicans are showing no urgency to serve the American people. Medical care services in rural America have been deteriorating for decades. In my state, I'm one of 8 states that does not have the Medicaid expansion monies. We've lost $15 billion in monies provided under that program, and my governor still says he's a Christian. So I have to just say whatever because of that. Let me give you a recent scenario. Byron Stribling in Belzoni, Mississippi, lost his wife, Harmony, who was 9 months pregnant. Belzoni is in Humphreys County, a county that today has no hospital at all, and it has not had one since 2013. His wife suffered a heart attack and died on the way to the nearest hospital, which is in Yazoo County. Now, under the big ugly bill, Yazoo County will lose its hospital. So now I want you to understand that's Humphreys County, no hospital, Yazoo County, no hospital, and the nearest hospital past those two counties is 45 miles away. Those are the kind of horror stories that people need to understand. Some of you heard about a mass shooting in Mississippi over the weekend. Well, Delta Regional Hospital is a level 3 trauma center. Now, a level 3 trauma center is just fortunate to be open, to be honest with you. And on that particular night, Delta had a contract surgeon. 6 people died that night. 20 people were brought to that hospital. And the best thing they could do is to get them transported to other areas. Now, 4 helicopters came to the area. Now, and it's bad, but it gets worse because the helicopter ride costs $25,000 per patient. So over and above getting them to a level 1 trauma center, that family or that individual is placed with that cost. So Republicans ought to be ashamed of themselves, putting families in this kind of situation. Democrats get it. That's why we're here working today. But more importantly, is the public needs to understand that those people who are not working on their behalf, they have insurance. So if anything happens to their family while they're out doing whatever they're doing other than their job, everybody's fine. Shame on Republicans.
Bennie Thompson's words hit like a shockwave, but they're grounded in the daily reality of millions of Americans. This isn't abstract policy or partisan theater, this is life and death. When he recounts a man losing his wife 9 months pregnant because the county has no hospital, you have to pause and ask yourself, what does it mean when government inaction compounds tragedy? Thompson doesn't just present numbers, he contextualizes them. The expiration of ACA tax credits doesn't exist on a spreadsheet. It exists in families paying 3 times their current premiums. It exists in small towns where the nearest hospital is dozens of miles away. It exists in trauma centers operating with minimum staff, forced to triage in situations where every minute costs lives. He frames this not as political rhetoric, but as moral responsibility. House Republicans are physically absent from Washington during a shutdown, and that absence isn't symbolic, it's literal harm. Thompson contrasts their absence with the people in their districts who will face skyrocketing costs or no medical care at all. And by highlighting the systemic consequences, hospital closures, emergency helicopter costs, underfunded trauma centers, he paints a full picture of how policy, budgets, and inaction ripple into human suffering. There's a lesson here about accountability and perspective. Legislators who talk about efficiency or fiscal responsibility need to reckon with what those abstractions mean when the consequences are measured in lives lost and families devastated. Rural healthcare is not a luxury, it's a necessity, and ignoring it exposes inequities and systemic failures that most Americans rarely see. Thompson's voice reminds us that government isn't a distant institution. It's a force that shapes life, health, and survival. Every decision, delay, or absence has real-world consequences. And when lawmakers are absent while millions of people are at risk, that's not politics, that's a moral lapse. This is why hearings like these matter, because behind every statistic, every tax credit, every budget proposal, there's a family whose life could hinge on the choices made in Washington. Thompson doesn't just report the problem, he forces us to see the human reality behind policy, and he challenges the public to demand accountability. If you want more in-depth, humanized, and educational political analysis like this, subscribe to Left Lens, share this video, and comment, how do you think lawmakers should be held accountable when their absence puts lives at risk?